Hi, I'm Dr. Wendy Cates, and I'm going to talk to you about different types of hearing loss and what happens when you choose not to treat your hearing loss once it's been diagnosed. Typically, there are two types of hearing loss, conductive and sensory neural. A conductive hearing loss affects how we hear through either our ear canal or through our middle ear space. When we have a conductive type hearing loss, sound gets damped out, so the mechanical transduction of sound gets impeded. Once this impediment is overcome, once the sound is made loud enough, typically the patients hear very normally. Some types of concerns that can cause conductive hearing loss are earwax, a hole in the eardrum, middle ear fluid, or a fixation of the middle ear bones, which we call otosclerosis. Typically, these concerns can be treated medically, such as tubes for the middle ear fluid, or a graft to repair the eardrum, or just removal of the earwax. However, there are some of these cases that cannot be helped by surgery. Hearing loss that affects the inner ear is what we call a sensory neural hearing loss. This term used to be called nerve deafness. This type of hearing loss affects the cochlea, which is the sense organ for hearing, or it can affect the auditory or the hearing nerve. Sensory neural hearing loss can be due to age-related changes called presbycusis. It can be due to a history of noise exposure, or it can be secondary to some of the medications that we take. Like a conductive hearing loss, people who have sensory neural hearing loss tell me that they hear sounds softer, and oftentimes that they hear sounds distorted. So sometimes once we restore the loudness of sound, we don't always restore the clarity. I've had a lot of patients tell me that they can hear speech just fine, but they don't always understand it. This type of hearing loss is not typically treated through medicine or through surgery. This type of hearing loss responds best to hearing instruments. There are some patients that have both a conductive and a sensory neural type hearing loss, and we call that a mixed type hearing loss. If you've been diagnosed with a hearing loss but you choose not to pursue treatment, there are some side effects that can happen. People with untreated hearing loss report depression, isolation, and anxiety. Data published by the National Council on Aging suggest that people with untreated hearing loss report more withdrawal from family and friends. They report a lack of security. They report worry, anxiety, and paranoia. That same study that looked at people who have hearing loss and chose to treat their hearing loss with hearing instruments found greater satisfaction with life, improved relationships with friends and family, and less worry. For those patients who have hearing loss that are still in the workforce, what we find is about $12,000 less per year of income. Research conducted by Johns Hopkins and other studies show that with untreated hearing loss, we have greater rates of shrinkage in the gray matter of the auditory cortex. The auditory cortex is what's responsible for speech comprehension. Lastly, what I want my patients to understand is that greater rates of hearing loss, the longer they go untreated, puts my patients at a greater risk for developing Alzheimer's and dementia. I don't want my patients to suffer any of these memory-robbing diseases.